Good afternoon, everyone. So I have a little question. What do you call a past Rotary president that keeps coming back, coming back? No? How about boomerang? So with that being said, let me welcome you to the September 15th, 2021 weekly in-person and Zoom meeting of the Rotary Club of Edmond. I'm going to ask Victoria to come up and lead us in our invocation and our flag salute. Thank you.
Let us bow our heads. Our Heavenly Father, we genuinely thank you for our group of Rotary, our group that believes and demonstrates service before self. We ask special blessing on our country leaders, our state leaders, our local leaders, and our first responders and military who have been through so much just in the last few days. We ask for your healing arm and hand over them and your protection. We ask that you be especially close to those who have lost members. We thank you for this opportunity to get together and share, and we ask that you guide us in the way in which we should go the remainder of the week until we should get back together again. In your heavenly name we pray these things. Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Thank you. You want me to stick this back on?
Yeah, just stick it on there. There. Thank you. Thank you, Victoria, for those comforting words and for being our invocation and salute to the flag leader today. Also, greeter Barry Bell, thank you, in the back, and Carol Hartzog, the registrar. Let's give them a round of applause. We are looking for some more My Rotary Story. Keith May, put your hand up. Please see Keith after the meeting, before the meeting, call him, text him. He is ready to tape. I think we've got some upcoming speakers up here. Next week we have Deanna Boston, then James, Dr. Casey Schrum, and Jennifer Seaton. And then looks like we've got trivia scheduled again for November 10th, so put that on your calendar. Also next week, Randy Taylor will be here to update your pictures. So as you come in this side door, it's going to be the first door on the right, so make sure your hair is coiffed pretty and you have a pretty top on or shirt, whatever the case may be. Try to get here a little bit early for that so the line doesn't get backed up. Thank you, Randy, in advance for that. Also, a big thank you for those that volunteered for the Arts Festival for Edmond over the weekend, and also those that were buddies for the Miracle League on Monday night. We had 16 Rotarians: Dan Chavez, Krista Jones, Brett Town, Chris Kohler, Amzi Gregory, Barry Bell, James Boggs, Natalie Bonney, Mike Osborne, Mike Sanders, Chris Berry, Beth Case, Jennifer Seaton, Keith May, Sandy Chappell, and Cody Hardy, who's not even a member yet, came in and joined us. And for those of you who didn't come, Josh hit a home run on his first pitch. So I think, Brett, he wanted you to contact the mayor, am I understanding? I think you were asked that question just a few times, just about 70 times, so hopefully you've done your due diligence there. So our next Miracle Night will be Tuesday, October 5th, so please see Jen Seaton if you'd like to be a part of that experience. I promise you, it is amazing. Also, on a personal note, on behalf of those who went to the Dancing with Stars for the Chamber event, our very own Krista Jones won the Best Entertainment Award. She did some amazing lifts and a cartwheel at the end that was 10 plus. It was over the top. And eyelashes too that I haven't quite seen, but it's quite interesting. But thank you, Krista, you did an amazing job. Sergeant at Arms today is our very own Andy Lester, adorned with an orange tie and an orange watch. Check it out. Yes, you are.
Well, welcome to the Rotary Club of Edmond, and welcome whether you are here in person or viewing us over the internet. It's great to see you. My job is, as Mike Sanders said the other day, is a very simple job. It's to slightly entertain you and to take some of your money. So, on the taking your money and slightly entertaining front, how many of you can tell me how many official, there are lots of them, but how many official avenues of service Rotary has? How many? I see 4 in the back. 5. 3,842. That's close. That's close. There used to be 4. That's true. Back in the olden days, when Natalie was president, she wasn't the only one that was a president in the olden days. I too was a president in the olden days. There were 4, but there are now 5 avenues of service. So what are they? Do you know?
I think it's education and literacy is one, right? Something like that.
Something like that. I don't see that on my list here, but.
Oh, well, I mean, are we saying verbatim or what? I mean.
Well, let's just go through what they are, and I do have them written out, so I've got a bit of a cheat sheet. Well, community. There are 5 avenues of service: community, club, international, vocational, those are the traditional 4, and new generations. Right, old folks would not know anything about new generations, not mentioning who old folks might be, but that would be about my age on up, so. Well, that's all right, but you got the right answer. If you didn't get the right answer, you might dig deep for $1. If your team last weekend beat a middle school by more than 70 points, this isn't a mandatory one, but you ought to dig deep for $1. If your team last week played a team that had lost to a middle school the week before and couldn't put that school away until the end of the game, and those of you who might be wearing orange, let's just say I've already taken out my $1 to prime the pump. You ought to dig deep and find $1. If you don't have your emblem, you're supposed to give me $1. If you're going to scoot, that's $1. Krista should have a day off from dollars because, frankly, she got robbed at the Chamber of Commerce. And if you would agree with me that Krista got robbed at the Chamber of Commerce, which she was, I mean, there's just no question about it, dig deep and find that $1. Does anybody have any announcements?
I turned 51 yesterday. I'm
Oh,
still
big money
Okay, this is the last time we'll hear from me about things in this village, but I just want to thank you all so much for those of you that are working was really fun. I'm still trying to recover
Yep,
from
no.
full hamstring.
He's
That
gonna
Sandy
announce a
Bird
club
Temple
guest.
helped me so that I could not only walk but dance even. So I appreciate that. The other winners were Kenneth Ball for Best All Around and Julie LeBlanc for She Got the Miracle. And then, of course, I did get the name for my team and my lap woman. So thank you, President Lester.
Oh, yes, today, what June is, Raymond James Financial Advisor. Also, good shout out to our president, he was on, we take on the development around the service organization, Mike told Monday night, something like we do that.
I'm going to show it this weekend. It's protetheater.com, the name of the show's Footloose. Doing a show that I've done previously to some of the Oklahomans, it's called Footloose. And the thing they changed this time is they put in, well, I call it an 11 o'clock song for Shaw. That's the character I play.
Do you have an announcement or? Announcements here?
First of all, I would like to introduce club guest Cody Hardy. Every week. So please welcome Cody, who's here with us. And then I do want, and I'm putting money in for like 10 of those things you said. But I really want to thank everybody who came out Tuesday night. The weather was awesome. It was a great time, and I think we all enjoyed watching and being a part of it. And I hope those who were there can come back the next time, and those of you who weren't there will want to come back the next time because it's coming up. Thanks a lot.
I'm going to piggyback my way on Miracle Week. Mike, where did you go? Where's Mike Sanders? Oh, there he is. There he is. Big round of applause for Mike. He was the MVP. He was the pitcher. He got heckled a little bit. He took it in stride. I almost called Krista in from the bullpen to replace him at one point, but I gave him a shot. He did a great job. I don't know, did you have to go home and ice a little bit?
Major League is at the Cy Young Award.
I don't have that.
Miracle League, I got the Cy Gold Award.
Very good. And I think Krista probably gave out about 300 high fives, and I had a really good time dancing with the new sound system with the second baseman. So please, please, please come out next time.
Okay. I think that's it.
Wowee. Thank you, Andy. So Carol was our registrar today, and we've got tickets galore, and I'm just saying, if anybody wants to bolt back to where Carol is and get some tickets, we'll put them in here for the drawing. So without further ado, who's introducing speaker today? Andy is. Okay.
Thank you.
Okay, our speaker today is Heath Hayes. So he serves as the Chief Communication Officer for the Oklahoma Department of Mental Health and Substance Abuse Services. So being a local government bureaucrat, like I am as well, I appreciate a long acronym. So that's one of those long acronyms. So today, Heath leads a team responsible for policy implementation, program development and service delivery, as well as community organizing, governmental affairs, and public relations. Heath is a nationally recognized leader, helping others embrace lived experience with mental health, and has successfully integrated recovery-oriented, holistic, and person-driven continuums of care at the local, state, and national level. So, and really one of the things he's going to share with us today is an exciting new initiative that's going to launch July 1 of 2022, which is going to be a comprehensive crisis response for the state. Turning over to Heath.
Thank you very much. I appreciate the opportunity to come today and share with you some exciting stuff. That's not usually my role or the job that we get to do in Oklahoma as it relates to mental health and addiction issues, because for so long we've experienced kind of some staggering statistic as it relates to people who die by suicide or overdose deaths related to drug addiction. But thankfully, this last legislative session, we had a significant investment into the safety net system of the Department of Mental Health and Substance Abuse system, which is kind of the safeguarded last resort, if you will, to be able to provide mental health and addiction services. And so that, with that historic investment that we received for this fiscal year, we are quickly building one of the best models that we would stand up against any other state in terms of how they increase the access to care and services for people who are experiencing mental health and addiction challenges. So I'm excited to be able to share that with you today. I'm going to go over kind of the component parts of it. There is a visual right there. There you go. Thank you. No, you're fine. That I'll go over, but it just kind of give you some information. And then, of course, if you have questions, I'm happy to stick around or stay to be able to answer those, because again, like I said, it's exciting, the news that we get to deliver, and I'm hoping that you will see an added value to your community. So thank you again for letting me come talk to you about it today. But in Oklahoma, as of this right now, this kind of the state of crisis for us is that about 4.1% of adults had serious thoughts of suicide within the last 12 months. If we kind of look at our kids, the youth, 1 in 10 students have attempted suicide in Oklahoma. And that is a very alarming statistic, it's a very alarming piece of information, and kind of just gives us so much more motivation to make sure that we do something about that. And that statistic, I got to clarify, comes specifically from something else that was passed this last legislative session, which is the Oklahoma Prevention Needs Assessment, which every school district now and every school system across the state will be required to participate in this, which is a survey that's administered to 6th graders, 8th graders, 10th, 11th, and 12th. It gives them an anonymous way to answer some very specific, candid questions. And so this is a self-report from that survey. So research indicates that there are oftentimes people are more likely to respond more truthfully if they do that so in an anonymous venture. So that 1 in 10 is probably a really true number. And so it gives us all the more motivation to build something that allows immediate access to care, which is kind of something that we haven't had for a very long time in Oklahoma. Because we believe that if people have access to care, and we know that if people have access to care, they are twice as likely to survive their mental health or addiction issue. The research is very clear on that, specifically in the system that we've built that already exists in Oklahoma. If you are to touch our system, or to be screened for suicide, or to be screened for potential addiction issue, and you're connected to treatment, or there's a brief intervention that's provided, the likelihood of your success in kind of managing mental health or addiction issues is exponentially better. So this all really kicks off. While we do have different component parts that already exist, by July of 2022, all of the system will connect, and that's a really exciting part. And it all really starts with a 3-digit number, and that 3-digit number is 988. And so you will see a national movement to kind of marketing and advertising 988 as a kind of single entry point for people who are experiencing a psychiatric distress, experiencing emotional distress, or just need somebody to talk to because they're going through whatever crisis may be. And crisis is all relative to each and every one of us. I will say one of the things that is a good point that has come out of the COVID pandemic is that we are more comfortable as a society talking about depression and anxiety and loneliness and uncertainty and all of those things, because a lot of us experienced that this last year. And so being able to kind of dovetail on that bigger or wider awareness of the issues that people face, and that depression and anxiety and those mental health challenges a lot of us experience ourselves, helps to kind of destigmatize the issue and encourages people to reach out. And it's nice that there will be a 3-digit number for people to reach out at any time, 24 hours a day, 7 days a week. What this number will do, and what will be on the other, who's answering the call center, it's a licensed behavioral health professional. And that licensed behavioral health professional will be able to kind of provide brief interventions over the phone and de-escalate whatever situation is going on. And research indicates that if you are able to do that, most of the calls that come into the 988 call center will be diverted and be resolved. In fact, 80% of them is what we project will be resolved at that touch point. What's really cool about the call center too is that if they're not able to resolve the situation or get you connected to care, we can get you a same day or next day appointment with your local treatment provider. And that is something that has never happened, and it doesn't happen in any other state. But having that immediate access and the ability to schedule you with a treatment professional so that you have ongoing connections and ongoing treatment resources for you is just, it's a game changer for mental health and addiction as a field. And so being able to call into this number, get immediate access to care, and or an appointment and connected to a treatment provider for follow-up services is the first step in this process. The second step, if we're not able to resolve your situation or resolve your crisis at the call center level, the call center will have the ability to dispatch what we call mobile crisis teams. And what mobile crisis teams are pairs of people across the state who are deployed to your location. And they consist of a licensed mental health professional and what we call a peer recovery support specialist. A peer recovery support specialist is somebody who has lived experience with mental health or addiction issues, is on the other end of their recovery journey. A lot of research indicates that people who share in struggle or who share in kind of the successes of being able to overcome or to self-manage an illness really helps to engage the other person in their initial talks and initial considerations, and also help to kind of de-escalate whatever crisis might be happening. And so that mobile crisis team will be deployed by the call center, and if they're not able to resolve that situation, there's a next step. But with the mobile crisis team, they'll be able to also do those same day or next day follow-up appointments so that you have kind of ongoing treatment and care provided to you if that is what you need to be successful in your journey of recovery. The other piece to this is integrated technology. You might have heard or you might have seen recently, but we have the ability now and are currently in the process of deploying all of these tablets to every single law enforcement officer. So a law enforcement officer will have a tablet with 24/7 access to a mental health professional. And so if law enforcement arrives on a scene and they know that somebody needs mental health or addiction treatment, they can use their tablet, push a button, and be able to immediately connect with a licensed behavioral health professional. This is another really big deal. We're leveraging technology, we're leveraging the geolocation of folks and being able to kind of be more efficient with the limited resources that we have as far as licensed behavioral health professionals, because they're all kind of centralized in this call center that will be connected to the outpatient treatment provider. And so law enforcement will have the ability to have somebody assessed, have somebody connected to treatment, or if they themselves, this is the other cool, there's another button for them. If they, the law enforcement jobs are really difficult and hard, and they see a lot of traumatizing things. And so if they themselves want to receive some debriefing, some counseling that's anonymous and free, then they have the ability to push the button for themselves. And so that's another really cool part of kind of the integrated technology component to this. The other thing that we'll be actually launching in November 1st, is what we call alternative transportation. So for the last 50 plus years, Oklahoma statute and a lot of states actually require that if somebody needs crisis psychiatric services, they have to be transported to a crisis center or a psychiatric hospital by law enforcement. I don't know about you, but it doesn't sound very appealing to have to be handcuffed and put in the back of a police car if you need mental health or addiction treatment, which is, again, not the best scenario, but because of our newer and more advanced understanding of what mental health and addiction is, we took a big leap and we've changed that law, and it goes into effect November 1st, which allows the Department of Mental Health to contract with a third-party vendor to provide that alternative transportation. So those mobile crisis teams, for example, could become the alternative transportation to connect somebody to a higher level of care, or to a psychiatric hospital or urgent care or a crisis center, or we can dispatch the transportation from the call center to be able to to help law enforcement, ease the burden of law enforcement having to be involved with every single mental health crisis, because it was just a de facto situation for them to have to pick up where the system failed and didn't have the services and supports in place. And so that part of this continuum actually launches November 1st. I leave here directly to go review the bids for the proposals of the transportation entity, and that will be, again, just another huge difference for our state. There's only 2 other states that have launched kind of an alternative transportation, but it's a big move in the direction of destigmatizing mental health and addiction services. So we're really, really excited about that piece. And then the last piece that I'll talk about, and then please let me know if you have any questions or clarifying information that you would like me to provide. But we're going to increase the number of what we call urgent recovery centers or crisis centers. What an urgent care crisis center is, they are more or less an emergency department or or urgent care that you would go to, an AM/PM clinic type of situation where you can get your mental health needs addressed. So currently in the state, we have about 10 of these that are connected to crisis centers. And so these crisis centers, the urgent care component of the crisis center, you're basically getting your needs met, whether it's medication, whether it's sometimes just a place to sleep for 24 hours, getting connected to resources, getting some intervention, some therapy, whatever the case may be, but getting you stabilized to a point where you can return to your home, return to your job, return to your family, and be able to receive ongoing treatment on an outpatient basis, because we know that that's the best situation for people to continue to live in their communities and be productive citizens. And so if that level of care does not meet your needs, you get transferred to what we call the crisis center side of operations. And what the crisis center side of operations does is more of 120 hours of and more intense treatment, more stabilization with medications if that's the case, so that we can get you, again, stabilized and then discharged to a point where you can continue your treatment on an outpatient basis. The research that we've done specifically on this model of urgent care and crisis center kind of treatment modality, those centers actually decrease ever even needing to go to a psychiatric hospital. So about 90% of people who reach this level of urgent care or crisis center, their issues will be resolved where they can continue treatment on an outpatient basis at the treatment provider in their community. And so this is the entire continuum. We're going to increase that last piece by 50% just this fiscal year. So we're currently analyzing the data to be able to see where the most people in need are so that we can prioritize those communities first, and then increase the number of those urgent cares and crisis centers every year after that. So that is the good news, the wonderful news that I have to bring to you today. We're super excited to be able to finally do what we've known we needed to do for a very long time. And like I said, it was by the grace of our legislator and our governor this year to be able to lift this up and make some actionable movements on making a difference for people who have mental health and addiction issues, and also the community, because we all know it is a very a personal thing, and it definitely touches most of us, because statistics say one in 5, 1 in 4, depending on what we're talking about, people experience mental health and addiction, but all of us have somebody that we know who experiences challenges with these issues. So thank you very much. I appreciate your time, and I guess now I can take some questions if you have any. Children, this is a lifespan situation. So children are included in the comprehensive crisis response. Yes, right now we are actually operating a mobile response unit and have for the past couple years, specifically for children, that people get access to by calling 211. And so we've had a little bit more experience with operating a mobile response team for children and youth, and that's how we're able to kind of learn some lessons and fine tune it and create a system for adults as well. Thank you, good question. Yes, sir.
You mentioned 1 in 10 kids attempted suicide. Do you know how the home environment correlates with that?
So yes, it does definitely depend on the community. And one of the things that we do with these Oklahoma Prevention Needs Assessments that are done in every school, and that will be done in every school for this next calendar year, there's a lot of different protective factors, is what we call them, and risk factors that exist within a community. And there are, I don't know if you've had a speaker that has talked to you about adverse childhood experiences, but Oklahoma is rife with adverse childhood experiences, and those include the incarceration of a parent, abuse from a parent, actually mental health and addiction issues of a parent. All of these, there's about 9 different categories, and if you have 4 or more of those experiences as a child, then you're more likely to experience severe issues of comorbidities, including physical health and heart issues as an adult. And so Oklahoma has high prevalence rates of adverse childhood experiences. And so, yes, the factors that exist in the home and in the community are very much a predicted value of being able to see what's going on with the 1 in 10 suicide attempts. Yes, sir. Yes.
To give kudos out to our Hammond Public Schools and Red Town in particular for the focus on mental health, emotional and social working for our students, and the Hammond Public Schools Foundation for spending a 5-year goal of $1.25 million for this program. I know this because I had a visit with Deanna Boston yesterday about my donation to the foundation. And then another shout out to the city of Edmond and J.D. Denver and Larry Stevens for the city of Edmond putting money toward mental health. And I just appreciate that because you are just showing us how important this is, and that we just see that support system in our cities, which is hard to do. For the city of also.
Awesome. Actually, congratulations. Yes, thank you for pointing that out. It is the proactive approach with the data that we're able to provide that gives a really good kind of next step, actionable items on what a school can do. One of the coolest things, I think, in my opinion, is the good behavior games. So it's a teaching modality that a lot of research indicates that if you use this teaching modality, it's low cost to be able to include in curriculum and things like that. It actually has a long-term effect on protecting people from developing addiction and mental health issues, because that's where the sweet spot is trying to prevent these issues, helping children and youth to cope, learn those coping strategies early on and just become natural habit for them as they grow up. So thank you. Yes, sir.
I have a comment and a question. The comment is, somebody's been interested in higher education in this state. If you ever hear anybody tell you that higher education has too many non-instructional employees, so we tell you where we don't have enough. And that's mental health.
Yeah.
And it's why I have on our campuses a lot of good mental health counselors and so forth. But you hear these statistics of 1 in 10, when you have to deal with the issues, you realize those statistics are real.
Yeah.
They're real life people, and it's a very, very difficult issue. I'm thrilled to hear about this law that goes into effect November 1st on the transient
Is there a significant movement in other states to catch up with where we'll be on November 1st?
Georgia and North Carolina. And Georgia has historically been just a little ahead of us in terms of their innovation and approaches to mental health and addiction. So we let them mess up a little bit and then we do better. Oh yeah, I definitely see that happening. Kind of, you'll see the conversation, and I'm hoping that we can pull it off really well out of the gate, and so that we can help kind of influence that for other states too. Absolutely. I don't think anybody else has picked up on this technology piece, because you hear a lot of conversations about having a mental health person with law enforcement, and that's just not feasible for us. We just don't have, number one, the funding to have a body in every single squad car, but also we don't have enough people going into the field in higher education to become licensed behavioral health professionals. And so that's another thing that is, as we look forward into the future, what should we do is to attract more people into our field. Yeah. Yes, sir.
5 years ago, we last heard about this. The funding for the Oklahoma Department of Mental Health was terrible. In fact, I consider it embarrassing. We're going to go. So, how are you doing now with respect to funding? Is it going up?
So we actually had the largest state appropriated investment in our budget this last fiscal year. And so that is what's helping us to build this system. And it was historic. You're right. I mean, we have a long way to go because of years and years and years of underfunding. We're having to, it actually caused us to be really innovative and creative with the approaches that we had to do with a little bit of money. And now that we have this money and know that what it is that we need to do better work, we're able to do that. So there are a little bit of federal funding streams that exist for us now because of the pandemic relief. And that, again, is all going towards building out this system. A lot of it's one-time money. I can actually share a secret with you if you want. I know I'm the communications guy, but sometimes I overshare. So, and I know that's not supposed to be my job. We are looking at specifically building a new psychiatric hospital in Tulsa, which is a partnership, a public-private partnership with the Veterans Administration and OSU. And we actually will break ground on that psychiatric hospital this fall. But because of the additional one-time infrastructure money that's been provided, we're going to get to double the amount of beds that are built into that hospital, which is a really big deal. The other hospital that we have proposed get a really hard look at is Griffin Memorial Hospital in Norman. It is over 100 years old. It's falling apart. We own way too much land in that area because at one point we used to operate a facility that was 4,000 people. It was a city within a city. And we don't use and haven't been able to use a lot of that land in a very long time, or a lot of those pieces of those hospitals, because some of those buildings are condemned. And so we're also proposing that we get to build a new Griffin Memorial Hospital with that one-time infrastructure money and add additional beds to that so that we can kind of catch up from the years of underfunding and neglect that we have had. So yes, thank you for the question. Yes, sir.
How do these programs address the homeless population?
That's a really good point. We do have specific kind of outreach, and that's actually how I got this started in this field. I went to UCO, was interested in mental health and addiction, and once I graduated, the only job or the first job, I guess, that was available was working with the homeless population, so I took it. It was not necessarily something that I found myself wanting to do, but it actually is the reason why I'm in this period, I guess, talking to you today, which is kind of, I'm just having this aha moment myself, so thank you for that. But your question is about the homeless population. And we have these specific outreach teams that reach the homeless individuals. And from personal experience and also kind of working in a systems level, which was a shock to me, so I don't know if it's a shock to anybody else, but most people who are homeless, about 80%, experience mental health and addiction issues. And so being able to connect them to those services and provide the wraparound treatment services for folks is a really big deal. Housing First is a model that Tulsa and Oklahoma City metro areas have employed over the last couple of years, which helps people to get into transitional housing while we provide them addiction treatment, while we provide them mental health treatment, so that they can be more stable and sustain the recovery journey. So this system, while it might not be directly impacting, there are other programs that we operate and administer that reach the homeless population to help kind of problem solve the issues that people experience when they're homeless. Yes?
How are you weaving in all the dollars that come in on Mexico settlement, and there's a lot of money coming to the state for that? Are you weaving with that? Are you services overlapping? Some of that's an issue as well, like
So,
talk a little bit about that.
yeah, so the question is, what are we doing with the settlement money from the opioid lawsuit? Was that the question?
Generally, that's probably separate case of calls, but are you overlapping in services? Are you weaving with them? Are you working together?
We do. The majority of the lawsuit money was given to OSU to do a lot of research and to provide treatment services. And we, since we're kind of the operational side of the treatment delivery system, what we have done mostly with the funding that are attributed to those funds is to provide medication-assisted treatment. So medication-assisted treatment is specifically designed for folks who are that have opioid use disorder. And so what we do is we give those medications, we train physicians, because you have to be waivered in a certain modality of prescribing practice. And so we help get more physicians trained with that funding. We actually pay for the medications that are provided as part of the medication-assisted treatment program, and those kind of wrap around what we call recovery support services. So employment, housing, all of those things that we know are indicators of people being successful in the recovery. So we wrap around those services so that people kind of get back to contributing members of our society. So yes. Any other questions? All right, well, thank you very much. I appreciate your time.
As a former, in my past life, drug and alcohol counselor for juveniles, I'm thrilled. That transportation piece is huge for me. So congratulations to Oklahoma and to your agency. Bring it on, because that's fabulous. So without further ado, our Zoom folks today: Cynthia Ormsby, Steve Conkin, Louis Bremer, Barbara DeMaio, Ray Hibbard, Steve Murdoch, Keith Kirsten, hi Keith, and Christine Meredith. Let's give them a big wave and say, hi, we miss you. So one of the things we do is our book for Ida Freeman. Keith has graciously picked, what do you do with an idea? And he says, ideas make us great. I hope you find this book giving you many. Best, Heath Hayes. And so one of the last things of your job duties today, Heath, is to pick a number for our scholarship drawing. Out of here. Jeff. And read us the last four.
All right, the lucky number is 4165.
Wow, yay, Victoria. Yay. We're looking for the King of Diamonds.
King of Diamonds.
Yes, ma'am. And there's a big pot of money, so?
Queen of Diamonds.
Oh, good try. That's awesome. So breaking news, I just got word from the North Pole that I am not allowed to come back next week. So in my place, Beth Case will be here. I have to resign. That's what Santa Claus says anyway. So we will see you next week for Deanna Boston from the Edmond Public School Foundation. And I know Krista just made a great big contribution there, so we'll hear about that. Go out and be great Rotarians. See you next week.